I'm here with Maddie Knutson today. Maddie's been working in our office a little over a year, and Maddie, I know you came out of the medical field. You've got 10 years experience as a medical assistant. You've been really helpful in coordinating these coaching programs with patients. And I'm just curious what you've seen in the last year in working with these coaching patients.
Yeah, so a lot of changes in patients, gradual, some quicker than others. What they're getting is tools to set them up for permanent success in their life. So can you tell me a little bit about your coaching program?
Yeah, I mean, everybody in life that really succeeds at anything at a high level has a coach, or maybe more than one coach. So great athletes have coaches, actors have coaches, successful business people have coaches. I've got coaches. I've got like 5 different coaches. And you know, I used to be one of those people who thought I had to learn how to do it all myself, right? Do everything myself. And it wasn't until I began to understand the value of coaching in my own life that I really saw my success increase. So a lot of people try to figure out health by reading books or going online or talking to their friends and neighbors and getting their opinion on what they should do. And obviously it doesn't work out real well because when they come to us, they're still sick. What they've tried hasn't really worked. And so I know you've seen that in the intakes with patients.
So I hear this all the time from patients. Some of their stories truly are heartbreaking. How is your coaching program different from what they've already tried?
Well, our program is really based on a different philosophy of how the doctor and patient interact. So most treatment programs that people have been through are just that. They've been focused on treating the patient, right? Mm-hmm. So the doctor if they've been through the medical route, then they've either had drugs or surgery, right? But there's alternative people out there that really operate sort of under the same model. So they'll do some therapy, they'll do give the patient maybe some supplements, maybe talk to them a little bit about their diet and lifestyle. But in the end, it's really the doctor treating the patient. I look at it differently. I feel like we need to give the patient the tools that they need to stay healthy on an ongoing basis. Health depends on what we do every day. And unless we can change those habits for people, the likelihood that they're going to stay successful is pretty low. I mean, I think about, I've worked with personal trainers before. And while I'm working with the trainer, man, I'm into it, I'm feeling good, I'm going to the gym. But unless I continue that after I'm finished with my training sessions, the likelihood that I'm going to stay fit is really not very good. And it's sort of the same thing that we see with patients. If they're dependent on the practitioner to feel good, or to get some therapy, or to have something done to them, and they don't make those fundamental changes in their lives, they're probably not going to be successful in the long run.
That makes a lot of sense. So how long is your coaching program?
I found that it takes 6 to 9 months for somebody to actually learn what they need to know and to make the changes in their life to stay healthy on a long-term basis. I mean, everybody's kind of looking for the quick fix, right? That's what we were used to. You know, you go to a doctor, they give you a pill, you feel better. But again, we already talked about why that's not sustainable. So, rather than going from the next fad diet or exercise or the next supplement that's going to cure everything, we really want to get people to understand where health comes from and what they need to do to keep their health on a long-term basis.
Okay. So I noticed that you always do an interview with a prospective client. Can you tell me why you do that?
Yeah, it's really important for me to understand who I'm working with. I mean, the program that we have, it isn't for everybody. I want to know what they've already done, what they've already tried. I want to know about their health background, but most importantly, I really want to know, like, what's their why? I mean, why do they want to get better? Mm-hmm. Because if they don't have a big enough why, it's unlikely that they're going to have the commitment level that it's going to take for them to make the changes they need to make. Because look, if if they could do it on their own, they would have already done it. They wouldn't need us. We'd be out of business, right? So I really need to know if that person's going to be successful. They really have to be committed to making the changes they're going to need to make to be successful in the long term.
Okay. So, I mean, what does a health coaching program look like?
So we're really guided by our underlying philosophy about health, and that is that health comes from the inside out. We have this incredible intelligence inside of us that knows exactly what to do to keep us healthy. If you think about something as simple as cutting your finger, and what happens that the body can actually heal that and close that back up. I mean, that happens automatically. We don't think about it. Now, in health, everything works the same way in the body. The thing that'll interfere, or there are several things that actually interfere with that innate intelligence's ability to do its job. So we need to determine what's interfering with their body's natural healing ability. So we'll usually do a customized course of testing, neurological testing, testing for toxins, testing for metabolic function at the cellular level. We really need to determine where the interference is coming from for that patient. And once we've done that, then we can design a customized program to help at least eliminate as much of that interference as we can. Then they've got a shot at being healthy again.
Okay. So you talk a lot about philosophy. How important is it to have the right philosophy and the right mindset about this?
I think it's critical. I think mindset is everything, right?
Yeah.
I mean, our mindset or our philosophy is really just a collection of beliefs. So our beliefs are really what drive our actions. All our actions come out of what we believe to be true. And our actions determine our outcomes in life. I mean, you can see that in any field of life, right? So someone who doesn't have very good beliefs or very healthy beliefs about money, it's unlikely that they're going to be very financially successful in their life. And it's the same thing with our health. If we don't really understand where health comes from, how our body stays healthy, our chances for success are really not very good.
Yeah. All right. Well, thank you, Dr. Bentz. That was really helpful in understanding what the health coaching program is.
You're welcome.
All right.